Today we are discussing a study that has been conducted to show the risk factors for contracting the herpes simplex virus infection and its effect on the human body and ways of preventing the contraction of the virus. The genital herpes is caused by the herpes simplex type 2 virus. It's one of the most common STDs or sexually transmitted diseases that affect the whole world's population. As you can see here on the map, almost every country has a huge number of infected patients with the human herpes simplex type 2. Genital herpes infection can result in severe complications in both neonates and immunocompromised individuals. And immunocompromised individuals who have very low CD4 count are at a much greater risk of developing those severe complications when infected with the herpes simplex type 2 virus. Immunocompromised patients might be those who are going through an organ transplant or those who got an HIV infection resulted in an acquired immunodeficiency syndrome or AIDS. The study has been conducted studying 60 men who had sex with other men, or what we are referring to in this study as MSM. The blood samples have been collected, venous blood, and we've tested the blood for the presence of IgG antibodies against the herpes simplex type 2 virus. We also have conducted the bivariant analysis to analyze the association between contracting the herpes virus and sexual behavior variables. We can see as a result from this study that a significant number of those who have shown positive test results for the presence of IgG antibodies against the herpes virus were not using condoms during their sexual activities. Also, the MSM who did not utilize water-based lubricants have manifested positive IgG test results. So we might have an association here between the water-based lubricants and the reduction of the transmission of the herpes simplex virus. The study also found that most cases, those who have been infected have engaged in sexual intercourse at earlier age, especially age groups who started getting involved in sexual intercourse between the age of 12 to 15. So this specific age group did show a much higher positivity rate compared to the rest of the age groups. So from this, we can conclude that earlier engagement in sexual intercourse might result in contracting the herpes virus. The MGM involved in oral sex also have had significant number of positive IgG tests. So we can see the correlation here between being performing oral sex and the risk for contracting the herpes simplex virus. As a conclusion that we can get from this study, we can find that not utilizing condoms while engaging in risky sexual behavior can result in acquiring or contracting the herpes simplex type 2 virus. Also, people who are having multiple sex partners or have been engaged in sexual intercourse at a younger age also will be at a higher risk of contracting the herpes simplex virus. Having other sexually transmitted disease, it's an association that we can find with people who also will have the herpes simplex type 2 virus infection. A higher risk for developing much severe complications from the herpes simplex virus is when a person has a weakened immune system. As a recommendation from this study, the scientists have recommended to avoid sharing personal items with others to prevent the spread of the viral particle transmission. Also, to not be participating in sexual activity while showing signs or symptoms of the viral infection, as well as to use protective measures like using condoms during sexual intercourse. Those are the references that we've used to conduct this presentation. Please feel free to check them out for more information. Thank you so much for taking the time to check this presentation. Have a blessed day.